When we think about global health threats, our minds often jump to fast-spreading viruses or infectious outbreaks. These are, without a doubt, serious concerns that demand our attention and resources. But there is another, more insidious epidemic quietly unfolding across the world. It doesn't spread from person to person through a cough or a sneeze. Instead, it develops slowly, often silently, within our own bodies. This is the world of non-communicable diseases, or NCDs. The main culprits in this group are cardiovascular diseases like heart attacks and strokes, cancers, chronic respiratory diseases, such as asthma and COPD, and diabetes. The reason these diseases are so concerning is their chronic nature. They are long-term health problems that require ongoing management and care. They can progress slowly over many years, sometimes with few or no symptoms in the early stages. This silent progression is what makes them so dangerous. By the time symptoms become severe enough for someone to seek medical help, the underlying damage to the body can be extensive. This makes treatment more complicated, more expensive, and often less effective than early intervention would have been. It is crucial to reframe how we think about our health. We must shift our focus from solely treating sickness to proactively building wellness. The rise of NCDs is not just a medical issue, it is a societal one, reflecting how we live, how we work, how we eat. The good news, and this is the most important message I can share, is that most of these diseases are largely preventable. Our daily choices, the environments we create, the policies our communities adopt, hold the key. By understanding the nature of this silent epidemic, we empower ourselves to fight back, not with a magic cure, but with knowledge, commitment, and simple, powerful actions. To understand why NCDs are becoming more common, we have to look at how our world has changed. Over the last century, human life has transformed at a dizzying pace. We have moved from farms to cities, from manual labor to desk jobs, and from whole foods to highly processed meals. This rapid modernization, while bringing many benefits, has also created a perfect storm for chronic diseases to thrive. Our bodies evolved over millennia in a very different environment, and are now struggling to cope with the realities of modern life. A major driver behind the rise of NCDs is the change in our diets. Global food systems now favor mass-produced, processed foods that are high in salt, unhealthy fats, and added sugars. These products are often cheap, convenient, and heavily marketed. At the same time, our consumption of fresh fruits, vegetables, and whole grains has declined. This dietary shift contributes to health problems like high blood pressure, high cholesterol, and obesity. Compounding the problem is a dramatic decrease in physical activity. Jobs are more sedentary, many of us spend 8 hours or more sitting at a desk. We commute in cars instead of walking, and our leisure time is spent in front of screens rather than outdoors. This lack of movement weakens our muscles and bones, slows our metabolism, and makes it harder to regulate blood sugar and blood pressure. Finally, we cannot ignore other lifestyle factors. Harmful use of alcohol and tobacco consumption remain leading causes of preventable death. We are living longer than ever before. Longer life is a public health triumph, but it gives chronic diseases more time to take hold. Crowded, fast-paced urban environments add chronic stress, which harms cardiovascular health and immune health. All these factors combine to make NCDs the rule, not the exception. The numbers behind the NCD crisis are staggering and paint a stark picture of a global health emergency. Every year, non-communicable diseases are responsible for over 41 million deaths, which accounts for a shocking 74% of all deaths worldwide. To put that in perspective, it means that 3 out of every 4 people who die today will die from an NCD. This is not a problem confined to wealthy, developed nations. In fact, over 3/4 of all NCD deaths now occur in low and middle-income countries, where they pose a double burden on already fragile healthcare systems that are also battling infectious diseases. These diseases also strike earlier in life than many people realize. Each year, more than 17 million people die from an NCD before the age of 70. These are considered premature deaths, robbing families of their loved ones and societies of productive citizens in the prime of their lives. The economic consequences are immense. NCDs place a huge strain on healthcare budgets, consuming resources for long-term treatments, medications, hospitalizations. Furthermore, they lead to significant losses in productivity as people become too sick to work or must take on roles as caregivers for family members. This creates a vicious cycle of poverty and poor health that can trap communities for generations. The human cost, of course, extends far beyond statistics and economics. Living with a chronic disease can profoundly diminish a person's quality of life. It can lead to chronic pain, fatigue, disability that limit one's ability to work, socialize, enjoy hobbies. The psychological toll is also significant, with many people experiencing anxiety, depression as they navigate their diagnosis and treatment. The impact ripples outward, affecting the emotional and financial well-being of entire families who must adapt to the challenges of providing long-term care for a loved one. This is why we must recognize NCDs as the #1 global health threat. Their impact is not isolated to a hospital ward. It is felt in our homes, our workplaces, and our communities. The trajectory of this crisis is not set in stone, and the next step is to turn our attention toward the powerful and accessible solutions that are already within our reach. The most powerful truth about the NCD crisis is also the most hopeful. The vast majority of these diseases are preventable. Research shows that up to 80% of premature heart disease, stroke, type 2 diabetes, along with more than 40% of cancers, could be prevented through simple, evidence-based interventions. This means we have an incredible opportunity to change the future of global health. The solution doesn't lie in a single breakthrough drug or complex surgical procedure. It lies in a collective commitment to prevention, starting with the choices we make every single day and the environments our communities create. The cornerstone of prevention is found on our plates and in our steps. Adopting a healthier diet is paramount. This means focusing on whole foods, fruits, vegetables, lean proteins, whole grains. It also means reducing our intake of processed foods, sugary drinks, and unhealthy fats. Small changes like swapping a soda for water or adding a side of vegetables to every meal can have a huge cumulative effect on our health. Similarly, incorporating more physical activity into our daily routines is essential. We need to aim for at least 150 minutes of moderate intensity exercise, like brisk walking each week. Taking the stairs, walking during a lunch break, finding a fun activity like dancing or cycling all count. Beyond diet and exercise, we must aggressively tackle tobacco use and harmful alcohol consumption. There is no safe level of tobacco use, and quitting is the single best thing a smoker can do for their health. Public health policies like higher taxes on tobacco products, smoke-free public spaces, and accessible cessation programs have proven to be incredibly effective. Governments and public health organizations also have a critical role to play in making the healthy choice the easy choice. This involves implementing smart policies that create healthier environments, building more parks and safe bike lanes, or working with the food industry to reduce salt and sugar in packaged foods. Technology can also be a powerful ally. Health apps can help us track our activity and diet, while telemedicine can improve access to preventive care, especially in remote areas. The journey to better health begins with small, deliberate steps. You don't need to overhaul your entire life overnight. The key is to start small and build momentum. Pick one area to focus on first. Maybe it's adding one more serving of vegetables to your day, or committing to a 15-minute walk every morning. This is also a journey we should not take alone. Share your goals with friends and family. Find a workout buddy, cook healthy meals together, or simply encourage one another to stay on track. When you prioritize your health, you inspire those around you to do the same. Your individual journey can become a source of collective strength. The fight against non-communicable diseases will be the defining public health challenge of our generation, but it is a challenge we can and must win. Your body is listening. Every nutritious meal, every step you take, and every cigarette you don't smoke sends a powerful message of health and healing. The power to stop this silent epidemic is in our hands. Let's start today.